This is a very basic introduction or refresher to computerized order entry for ED providers. So here from the tracker, you can launch into orders on an individual patient. The thing to drill down into here is this row of three buttons. Orders, where you order individual orders, meds, where you order individual medications, and then sets, which have categorized the different groups of order sets we have for the entire hospital, including here for emergency. To come back to orders for a minute, hopefully you won't have to do this too often, but if you just type into the search bar here what you're looking for, it'll drill down into it. So this is how you'd order an individual CVC. One thing to be aware of is that if you have, for the ED nursing orders, things that a nurse would do in the emergency department, if you type in ED as a preface, then it sorts out all the other stuff we do in the rest of the hospital. And then you can type in what you want, ED, I don't know, splint, or ED repeat vital signs. So there are a host of nursing orders in there, one of which to be aware of too is that ED, MD to nurse communication is one where if you want to just send a note to the nurse through the tracker board, that's a good way to do that as well. Individual medications, again, it's a type ahead lookup, so you just start typing in the word and it drills down into the dictionaries. And again, hopefully you won't have to look up too many individual medications. Because we think we have built an adequate number of sets to cover the vast majority of scenarios. So again, I encourage you to scroll through here and look at the different types of sets that we have. The more familiar you are with these before we go live, the easier it will be on that day. You can also use the search bar to search for order sets. So if you do ED chest pain, you can see that there's one that's geared towards getting the STEMI patients through there versus ones with kind of lower risk chest pain, or ED respiratory. So that's just a very basic introduction to get you started, to get you into this, and I encourage you to go into the test system and start playing around with the patients. You can do no harm in there, and I think it will help you a lot.